Hello to everyone. Again, it's another FB Live of Dr. Farrah. So, I just want to invite all of you to come and listen and also look at me. watch us.
Karen
Hello,
and Rio.
Karen and Rio. Yes, good morning. So, she's the one. She's our winner. So, good job, Karen. You're the winner right now. But I still want to say hello to everyone. Hello, Sir Nick, of course. Jean Balcueva Testado. Okay? Thank you very much. Miss Lori Garcia, hello po sa inyo. I wanna welcome you all. Yes, of course, yun yung mga laging nanonood sa atin. Valmonte RTV Osner is watching. Hello. Kim Blagantio is watching right now. Yes, nag-hello si Miss Lori Garcia. She's saying hello to us. So, before we start, of course, we will have a disclaimer. So,
Sure.
Hit it, Sir Jack.
The watching and interacting with this video does not constitute or initiate a doctor-patient relationship with Dr. Farrah. The information being provided by Dr. Farrah should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this broadcast or on any website or other medium of any kind associated with Dr. Farrah, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply the views and opinions of Dr. Farrah and myself, and as such are protected under the First Amendment. Dr. Farrah is a highly experienced medical doctor, Harvard trained in neuroscience and evidence-based nutrition.
It was difficult. Yeah.
Not some blind enthusiast promoting the wild and unrestrained use of nutritional products for health issues without evidence of therapeutic benefit. She has personally and keenly studied everything she recommends, and more importantly, she's closely observed the reactions and results in a clinical setting with patients countless times.
Yeah. But you know what's my best job?
Being a wife and mom?
Of course. Yeah, and being friends to all of you there. Hello po sa inyo. Hello, Margie B. Yes! Sa wakas. Nandyan ka na din, Margie B. So before we start again po, I just wanna reiterate, okay, the drfarrah.com is already online, okay, and it's live. Mm-hmm. So if you have any problems, if you have any questions regarding the Dr. Farrah brand, so you can just log in there, drfarrah.com, amazon.com also. Of course, they're shipping worldwide. BostonSea.com, courtesy of my friend, the beautiful, the sexy. So, I don't know if she's watching. Jack Budge. No, Miriam. Yeah, Miriam from Zen, Canada. Hello, Miss Mimi.
You guys should remember that because you may remember Miriam Defensor Santiago.
No, but
she was a fighter as well.
But she's a good lawyer. She's a good lawyer.
Quick hello to Aidan Flores, Angelica Nash, Margie B. And I saw Jody Kirchner.
Yes,
Jody Kirchner was my neighbor when I was a little boy.
Was she a good neighbor?
She's a great neighbor.
Are you a good neighbor?
Not so much.
Okay, so Sir Jack is not a good neighbor. You have to be good neighbors because my dad told me that neighbors are like good fences. Mm-hmm. Okay, so they will protect you. They will offer some form of protection. Hello, yes, I will just finish. Okay, so if you're in field, go to drfarrah.brilliantskinessentials.ph or just private message Elijah C. Cruz in Facebook. And of course, we're all of our distributors there. Nick Vargas, like I said, he's in Australia, New Zealand, and Oceania. So those part in Papua New Guinea, if you know that. So they're all there.
But Mama New Guinea.
Mama New Guinea. Is there a Mama? No, there's no Papa. There's only Papua New Guinea. Okay. Next is Gil Matani, of course. He's in Hong Kong and China. And I hope everything is still doing good in Hong Kong.
It's concerning. It's concerning to see, obviously.
Yeah.
I hope everything works out for the best there.
Okay. So, to all of the OFW, I'm so sorry that is happening.
Yeah.
But we are praying for all of you.
Mm-hmm.
Okay?
Mm-hmm.
So, next is, of course, Arceli Kulaban. She's the one in Middle East, Qatar. So, those part of the world. She's the one responsible for that. Mm-hmm. And also Butchoy Amor from... Butchoy Amor is from United Kingdom and Europe. So if you have any concerns, just private message Butchoy Amor. And of course, we have a new one From Hawaii, Miss Elizabeth Sante. So from Hawaii, all those people, or even if you're in different parts of the US, so if you know Miss Elizabeth Sante and you're a good friend of him, a good friend of her, so punta lang po kayo doon, just private message her. She will be the one to help you as well.
I can't wait to take you to Hawaii, Mama.
Have you been to Hawaii?
A couple of times. It's a beautiful place. The people are very wonderful, very engaging there.
Is it like Phil?
It's there's significant Filipino American communities there. I just want to see you dance in a grass skirt for me.
What is that?
The grass skirt.
The grass skirt.
The grass skirt, yeah.
Okay. I think the Filipino also has grass skirts. I'm not 100% sure. Okay, so I want to say hello again to Dre SP. Yeah, of course. Hi, Doc Farrah and Sir Jack. And Andrea Go, Rampola Anchet, Marl Zach. Yes, watching here from Laguna from my work. Food manufacturing, hello. Karen Andreev, of course, from
We just met someone from
Iloilo.
Laguna the other day.
Oh yeah, she's actually here. She's staying here in our place.
She's here in Oklahoma. Her
Yes.
son is in our son's class, and she says, She said to my wife, "You look Filipina." Are you from the Philippines? My wife says,
I
"Yeah."
am, yeah. Of course, we all look alike.
But she's Filipina.
Yes. We know it. If it's a Filipino, we can vibe it. Diba? Mga Pilipino dyan. So we can know if it's a Filipino, there's some form of like a connection or some, I don't know what you call this, you know. So you can see. Yes, Imelda.
Or they're smelling the stinky fish.
So they said that she doesn't have any sound. Can you hear us? There's one who said that they cannot hear us. I'm sure you can hear us because if they cannot hear us, they would already automatically say,
Oh yeah, someone has said that.
we cannot hear you.
Yeah.
Yes. So, Kumisol Cruz, of course. Kumisol Cruz is saying like this. She's present. Yeah.
And accounted for.
Paz Di Maangay. And Hazel Ezra, Q Palma. John Paul is watching from Dubai.
What are your thoughts on low carb diet or the infamous keto diet? Well,
Yes,
first of
later
all,
we're gonna talk
we will
about
address
that.
that.
Yeah,
I'll write that down.
because I want Sir Jack to because we're gonna have a trivia first.
Oh yeah.
So what is the trivia about, honey? Later, just tell me.
No. Because then everybody's gonna pull up their Google search and be ready to go.
Matalino talaga si Sir Jack. Me, I just don't think about it. Okay, J.R. Castillo from Paco, Manila. She's asking good morning here. You know, today it's actually, it's almost Thanksgiving, although I do not celebrate Thanksgiving. But it's cold out here right now. I think it
Baby,
went to
it's
negative,
cold
what is it?
outside.
It went to negative 5.
-5 to -6.
Yeah, so there's a lot of frost. But it's not snowing. There's just frost. Malamig. And I thought it's gonna be
Hello,
brutal.
Viking.
Like the first time. No, the first time that we came here, we thought it was brutal, but it was okay. So,
Oh, yeah.
mabuti naman because of my arthritis.
Not
Yeah,
that old, Mom.
unfortunately, because I'm old already.
Not that old.
Yes. So, Rina Rain, yes. Alisa Di Jose is saying she's missing me. I'm missing you also. And Miss Norma Antalan, welcome. Arlene YB, good evening po. Watching from, of course, Manila. Sophia Merek, yes. She's asking if we can visit Italy. Actually, that's one of our plans. We're gonna be doing some tours. And we will start our tour in Asia. So, watch out for that. I will tell you, we'll start our tour in Asia, in Hong Kong, and in China. When everything is good, in Singapore. Yeah, hopefully, umokay na yung mga nangyayari dyan sa Hong Kong. Kasi, it's heartbreaking, you know. You see, to see a country that is flourishing. It used to be, you know, the number one. Not really the number one, but among the top country in the world.
Now it's kind of tearing itself apart. It's really sad to see. Well, thank you, Gilbert Abelanosa.
Yes.
Nice voice, Sir Jack. In a world where there are many unpleasant voices,
You should hear Sir
comes a
Jack.
man with a pleasant voice.
You should hear Sir Jack sing. He's a good singer. Yeah. My dad, when my dad was still alive, he was always asking Sir Jack, can you sing?
Oh yeah, he would like me to sing Elvis. You want me to sing, You know, oh
Backstreet-
baby,
Backstreet
baby,
Boys.
how was I supposed to know?
That's Britney Spears.
Yeah, you made me sing that stuff.
Okay, so before we answer all of your questions again, so Sir Jack will give us a trivia. So
Oh,
for
sure.
those who will answer, you will receive 5,000 pesos.
And remember, it's whoever appears first on my screen right here, and I take a picture just for verification purposes. What is the first movie for 5,000 pesos in which Indiana Jones appeared? What's the first movie in which Indiana Jones
First movie
appeared?
in which Indiana Jones appeared.
Correct. What is the first movie in which Indiana
I
Jones
don't know
appeared?
I don't know what you mean. Okay. So what is the first movie in
Yeah.
which Indiana Jones? Okay.
Right. You can say,
So
as
the
well,
first
what is the
movie.
first Indiana Jones movie? What was it called?
Yes. So what is the first Indiana Jones movie? Yan.
Hmm.
Because as you know, as
For 5,000
Filipinos,
pesos.
sometimes we need to have a question redirect. So, can you redirect, sir? Okay. So please answer that first for you to win 5,000 pesos. Belinda Topase, Topes, Raku, sorry.
That's
po.
close enough. Melanie.
Yes, malapit. Close enough. Yes, no, not Melanie. Is she the winner? No.
Yeah.
Okay, so Sir Jack said that you are the winner.
Well, it's the first one that
Melanie.
showed up.
Yeah.
You know, it's close enough.
It's actually the lost art, not
Right
the
as-
list art.
Raiders of the Lost Ark.
Yes. Margie B is saying that she is not a movie lover. Yes.
So
no.
Melanie, after the broadcast today, be looking for a message from me because you won
Yes.
5,000 pesos.
Okay. So, no, I'm so sorry, Miss Comisol Cruz. You did not get it.
Temple of
Yes.
Doom. No, that was the second picture.
Yes. Okay. But it was nice, right? Have you seen that movie? I thought it was a good movie.
Yeah, isn't that Malik and Young?
Yeah, it was a nice movie. Okay, so we're gonna talk about, because Nick Vargas is telling me to when I woke up this morning, he was telling me, Doctor, can you talk about colon cancer? Okay, but I will give you an additional. I will talk about cancer again. So I've talked about cancer for like many years already, and again, when you have cancer, it's not because you are malas. It's because of different types of factors. So there's an interplay between your genes, your lifestyle, activity, your exposure to chemicals, even your work, your occupation, or even in your house. Just being basically in your house increases your risk of developing cancer, whether it's a toxic house. So again, we can discuss about the toxic house later. So when you are exposed to this, there's a normal cell, diba? Typically, it's normal cells. And then repeated exposure. So one time, if you have an exposure to this, there was this rogue, it's called a rogue cancer. So this rogue cancer, he didn't want to change himself, he didn't want to listen, he didn't want to die. Because some cancer, they would typically die. Our body would typically eat them. You call it apoptosis. Okay? So, usually, ayaw nilang mamatay. They would just continue growing. And then, when they grow, they can be harmful to the body. They can do so many damage. Okay? So, typically, if you have cancer, you will have non-specific signs and symptoms. So what's the non-specific signs and symptoms, Sir Jack?
You can have a fever.
Mm-hmm.
That can go with that.
You can have fever.
You can have general malaise. You can have flu-like symptoms.
Weight loss.
Weight loss.
Okay, so you cannot.
Swelling in a particular area of the body.
Yeah, anorexia. You may not sleep well, insomnia, or you might be sleeping as much. So these are non-specific signs and symptoms. You may also have bleeding. That's why some people, especially as Filipinos, we will not seek a medical doctor unless some of us are dying. I'm so sorry, but that's like me. I would probably.
No,
I think it's part of the. I think
we
it's
saw
part
that a
of the
lot.
culture.
No,
yeah.
we really saw that a lot because they were afraid of what the doctor was going to say, and so they would wait for 6 months. They would wait for a year, and it would get worse and worse and worse until finally they would come and see you.
Yes, and then it's already cancer. Now, the problem is, if it's big, you know, sometimes when they come to you, it's already too late. They would probably be stage 4. And that's the most heartbreaking news to tell that person is that you're already in stage 4. And then when they're already in stage 4, you have limited. Unlike if you're stage 1, you know, or in the pre-cancerous stage, of course, these things, they have a higher chance of getting better. But if you are in stage 4, most probably, but not a lot, okay? I don't want you to think that cancer is a death sentence, no. So, but if you are on those stages...
It's not a death sentence. What is it?
Yeah, it's a change your lifestyle sentence. Just change your lifestyle. And always remember, we have an amazing machinery, body. We have an amazing body. Jehovah made it that way. So we can just, and if you have a perfect diet, like what I said, if you have a perfect diet, it can revert back. There are certain products, or there are certain phytochemicals that have been proven to reverse cancer. Okay? So do not lose hope. Ayoko naman na nalulungkot kayo. Sometimes because they get so devastated, you know, when you get the news.
Yep.
Okay? So, again, those are the non-specific. But what about the specific symptoms? Diba? So, with the specific symptoms, depending on the organ that is affected. For example, if you have breast cancer, usually you can feel a mass. Okay? May nakakapakang mass. And then, lymph nodes. And then, sometimes the skin, you will feel it's like a peau de orang. Sabi nila, diba? It's like the skin of the orange, so that's how it is. And then there would be bleeding as well. So now, if it's a colon cancer, most probably you would have symptoms of constipation or diarrhea, or alternating constipation and diarrhea. Again, if it's colon cancer, you would have diarrhea or constipation, or diarrhea and constipation. Then you would have bleeding. So when you poop, or when you have your bowel movements, tatai ka ng dugo. So you can have anemia. Okay? Sometimes the bleeding can be frank. Frank, it means you can see them, they're very visible, or it can be occult, or you don't know it. Yan. Tapos, makikita mo na lang through CT scan. If they will do a CT scan on you, and then they would do a biopsy. Okay, that's what's normally is gonna happen when you're in a doctor's office. You will know that you have a mass. So, depending on the part of the colon which is affected, the symptoms can also vary. So, if it's in the rectum, so you can feel the mass, okay? And then sometimes you can have constipation. Now, if it's in the right colon area, you can have anemia. So, that's the most common symptom. And then you can also have bleeding. Yan po yung mga symptoms. Now, if it's if it's in the prostate, you have prostate cancer, of course you will have symptoms related to your urinary, okay? So, you can have impotence. So, hindi tumatayo. Yung ari natin, hindi tumatayo. So, hello to Josper. I saw Josper. Yeah. So, second is, you can have dysuria, mahirap umihi. Yan, mahirapan ka ding tumae, constipation if you have prostate cancer. So you have also hesitancy, yan, urgency, or you're gonna pee, tapos konti lang naman, basta iihi ka na naman. So, nagkakaroon ka ng UTI, okay? So, depending on the organ that is affected, your symptoms can vary as well. But do not be scared, okay? In literatures that I said, typically, an average person will develop cancer 6 times in their lifetime. Okay? But every time, they will fight it. They will fight it 6 times in our lifetime. We can develop cancer.
Known as a proto-cancer.
Yes. But we can fight it. So just have a perfect diet. I mean, if there's one thing that you can learn from this video is that have a perfect diet, because whatever you put in your mouth, you absorb. And if you absorb that, if it's toxic, you absorb it. You're gonna be just absorbing toxic substances. Whether you believe it or not, that's how it is. Okay? And then just make sure that you live in a house that's free of toxin. You know,
toxic chemicals, toxic cleaning chemicals.
Yes, like in my house, I have a lot of plants with my pothos. Yeah, and they call it pothos. And then you have the fern. So these plants, they have the capability of absorbing toxic chemicals. The toxic chemicals that are usually found in the house are benzene, toluene, formaldehyde. Okay, we get the benzene and the toluene from the paints. Okay, the formaldehyde, we get it from our furnitures. So, especially when it's very, lalo na pag mainit, when it's hot, they can just evaporate. Tapos yung anak mo, naaamoy niya, they can smell it. You know, that's the most terrifying for me, our children. You know, they can just smell. They can absorb, they can smell all these toxic chemicals. And then magugulat ka na lang, they have leukemia already. Especially toluene and benzene.
I actually remember as a kid, we used to have public service announcement commercials about changing the paint, because back then there were a lot of lead-based paints. And a lot of children would eat them.
But that was how many years ago?
It was back in the 70s.
Oh, imagine, I think, as far as I can remember, this came out only in film, like only in the 2000 something, right?
Yeah,
imagine in the US, they already know.
1970s.
They already know that the paints, they have lead. It can cause certain health conditions. But as Filipinos, diba, kailan lang sinabi sa atin yan? Oh. So we do not know. But we know that there's a lot of toxic substances in the toys in our house. So nakakatakot. So
actually,
just be careful with that.
Just to answer a quick question, that up top there, that is a humidifier.
That's a humidifier. Yan, okay. Kasi malamig. So the problem is if it's too cold, it makes your nasal cavity very dry. So usually in the morning, ang dami mo ng boogers. You will have tons of boogers.
Oh yeah.
So it's all over. Like my children, they all have boogers.
So, if daddy forgets to fill it up, there's lots of boogers.
Okay. So again, just for you to know, cancer, it's not a death sentence. It's a change your lifestyle sentence. Now, nagkaroon ka na ng cancer. You have been diagnosed with cancer. What are you gonna do? Okay, sabi ng doctor, you have cancer. And then you say, Doc, what stage? Okay, stage 4. They will tell you stage 4 like this. What is the next thing to do? The next thing to do is ask for a second opinion. Huwag kang maniniwala kagad. Okay?
Because these are opinions.
Yeah, opinions. And we are imperfect.
We're imperfect.
Humans are imperfect. Okay? So it
so
doesn't mean if I tell you that you have stage 4, it doesn't mean that you really have stage 4, okay? Or you have cancer.
That doctor may be looking at the wrong paperwork. You have to understand, there have been many situations where patients had come to my wife where they had gone through double mastectomy, radiation, chemo, and as my wife would look at their paperwork, there was no evidence that they ever had cancer. None. Yet they would go through these things. So always get a second opinion, because that person might just be wrong.
So you ask for a second opinion. Pag sinabihan ka kagad, huwag ka kagad maniwala. Even if they're professionals, even if they are not professionals, but even if they're specialists. So they have been seeing cancer patient for how many years? So it doesn't mean that if you have been in the condition 100, I mean, if you have been in your practice for 10 years, that you've seen tons of patients. No, you can be in a practice for 10 years or 20 years since you only 2, 3, or 5 patients.
Correct.
It doesn't mean that you're a specialist, because you went training on a hospital, but on your practice itself, you don't see a lot of patient. Then for me, you are not considered really a specialist. Okay, so it's better to find second, third or even fourth opinion if you can afford it.
And always
okay?
consider the credentials of the person as well. If they're claiming to be, some form of expert in the treatment of cancer or degenerative illnesses, are they a legitimate doctor? Or do they just use that? Do they just use the term doc or doctor in front of their name?
And then you will be given now. Okay, you have established your cancer, your stage 4 colon cancer, stage 4 established mo na yan. So, what's the next thing to do? The next thing to do is to ask yourself, okay, yes, this is cancer. What type of treatment do I want to have? Okay, now, I cannot say this for you. You have to decide it on your own. Do you want to do conventional medicine, which is chemo, radiation, or operation, or you want to do natural? Okay. Now, if you want to go on the conventional, you have to prepare yourself. Kasi they will not only do chemotherapy once. They would usually do chemotherapy 6 times. Okay. Now, do you have the money for that? Baka naman ang kaya mo lang is 1 chemotherapy. It will not make a difference. If you only can afford 1 chemotherapy, it will not make a difference.
No.
Or you're gonna do radiation. Radiation, how many days is the session for radiation? So that's around typically 31 to 45 days. So these are the questions you have to ask yourself. Your body, how about your body? Can your body undergo operation? So especially the extremes of ages, if you're very young and then very old. So can you handle the stress? So these are questions that you have to ask yourself.
Yeah, I understand that when it comes to the entire process, these people, these doctors, they are only people just like you. They've just gone through a particular set of training. And it doesn't mean that they're, very, very good at it. It just means they were able to go through that particular training and pass the licensure for it. So always seek out additional opinions on this, because this is your life, and ask questions. Ask a ton of questions. When you start dating someone, you're perfectly willing to ask them hundreds, if not thousands, of questions. Yet when folks are diagnosed with an illness such as that, they're happy just to sit there quietly because they don't want to offend the doctor. You don't want to offend the doctor.
You have to ask questions.
Ask questions.
Huwag ka magalit.
Is this going to cure me? Does this have the potential to significantly, lengthen my life?
I think that's the biggest question. Gagaling ba ako? Doc, pag ginawa mo ba yan, gagaling ba ako 100%? And of course, the doctor will tell you there's no 100% assurance, because there's really no 100% assurance. Okay. I have good news, I have good news for all of you. Probably by December, I will tell you, okay? So, good news about something. So, but what I'm trying to say is that all procedures, they're not 100%, okay? You have to always research, think about it, pray. Kasi tayo naman, in the end, like what I said, we are imperfect. In the end, we really cannot save ourselves. In the end, we really have to die. And of course, for some people, cancer is like, again, what I said, a death sentence. So, some
because
of
they
them,
accept it as such.
Yeah, some of them, they will be sad, they're gonna say goodbye. Like me, when I just have a fever, I already say goodbye.
I love you,
to
honey.
surgeon.
Goodbye.
Honey, you have a fever. Come on. Such a fatalist.
Diba?
Take care of my children.
I don't know who's like me. I don't know, katulad ko po ba kayo? I think I'm the only one who does that. Like when I'm sick, I'm having a fever, lagi ko na lang sinasabi, ingatan mo yung mga anak natin na pag namatay ako. I know, right? I don't know. So, Gwen is saying, masakit kasi ang fever, and Kumisol is laughing. I don't know if you're like me. I don't know. It's just me sometimes. So, I think about that. Yes. So, Mary Hazel Ruth Chekwa is saying something. We will see.
We'll see.
Okay, I'll tell you this
We'll
this
see.
December. Okay.
We'll see.
So after asking those Yes, Maggie Pasawal is saying, yes, she's also like me. Rocky Gabriel is saying, grabe naman. Also, Kenjaya is saying that she's like that. Right? You take care of my children. And I already told my husband, like, you can marry, but make sure that they're good to my children.
I'm like, what? You have a fever. What the heck are you talking about?
Right? So, I mean, yes. So, Janet is saying that she's also like me. Yes.
Live. Choose to live. You know?
I'm
Don't say,
crying
I
because
have a fever. I have a pimple. I think I will die.
Eric
No,
Pamos.
live. Live.
Yeah, if you see a pimple, like, oh my God, I have a pimple right now. Yes. It's just so funny. Okay. Yeah, so anyway, if you decide to go, if you're a cancer patient and you decide to go conventional, and you have to know that this will take years. Hindi lang po one time. This will take years and you may not be able to work. Especially if you are only the working person in your family. Nag-iisa ka lang, 'di ba? So you're the breadwinner. I mean, ikaw lang mag-isa. Tapos yung mga pamilya mo, they're all depend on you. Tapos hindi mo pala kaya, naka-isang chemo ka lang, natanggal na lang yung hair mo, you just had your hair loss and you said, I don't want anymore. Then sayang. Sayang ang pera mo. Sayang ang pera mo, sayang lahat. Now, if you choose natural medicine, marami yan, okay? That's the dilemma with natural medicine because it's tons. Okay? And they're also not expensive. They are expensive, but there are also that are cheap. Okay? So you have to do your research if you want to undergo treatment like that. But the best thing that you can do for yourself is to change your food, change your environment. Do not put makeup. Do not put makeup. Do not put lotion. Lalo na yung lotion I'm doing, we discovered something about the lotion and the shampoo really talaga. And they can cause absolutely infertility, absolutely cancer. It's just in all the research, in most of the research that we have seen right now. So, change your shampoo. Just simply changing your shampoo, changing your soap, your makeup, everything. It's just, small changes. It can really help. You have to do that.
Aiden Flores was asking about signs of anxiety. I can remember when I was in the military and first time I jumped out of an airplane, that was a sign of anxiety.
Were you
I didn't want to do
upset?
it. I didn't want to do it.
Were you upset with
I wasn't upset. I just didn't want to do it. I mean, you look down, it's like, whoa, Nelly.
Well, stress, anxiety, and some mental problems. If you look at it biochemically, there's a problem in the neurotransmitters in your system, like the serotonin, the dopamine, the endorphins. You have all of this. You have endorphin, enkephalins. These are the receptors. These are the neurotransmitters that makes us happy. So biochemically, if you look at their brain, some of this they are below the normal, okay? Like there was one documentary about pedophilia that we were talking about, and they're saying that it's also a wrong connection in the brain. So there are many research right now that has been associated with problems with neuroplasticity, with the connections in the brain, that can be associated with problems in the behavior, like
basically things getting miswired.
Yes.
Basically how, for example, like you said in that particular documentary, they're talking about how there are particular parts of the brain, instead of being wired for parental type responses and protection type responses, they're wired towards attraction, in a very negative way.
But this is what the science tells us, diba? Ang dami and actually, when I studied the neuroscience in Harvard, I realized that Jehovah made the body magnificently. Ang galing-galing talaga ni Jehovah. Yeah, he's the best engineer. And there are reasons why he made that ear like this, diba? Ang pangit-pangit ng ear natin. By the way, I never really liked the ear like this, but if you look at it, it's actually good as well, diba? Pero bakit ganyan ang itsura niya, diba?
Best for anxiety, Aiden Flores, is magnesium.
Magnesium, manganese, kava-kava, St. John's wort, yan yung mga nakakatulong. And of course, you do also yoga, diba? Yoga, you talk to people. Sabi nga sa Bible, if you isolate yourself, it's not gonna be good for you. So these people who have anxiety, stress problem, go out, talk to people, you know? Even the people that you do not know, probably they would say, this
Who's
person
this
is
weirdo?
crazy. I mean, out of nowhere, you would just talk to someone. Hello, I have some problems. Like, I know, if someone would talk to me, come to me, I don't know them, they would talk to me.
Oh.
But that's really how it is.
Real
Just
quick,
go and
real
talk.
quick. But hello, Mick, you keep saying it on there. For 5,000 pesos, who is the star, the male lead in This Guy is in Love with You, Mare?
Oy, so who's the lead of This Guy is in Love with You, Mare? So who? Yes.
Who's the lead
So
actor?
Jasper is saying pray. Yeah, you have to pray because prayers are good for us. Yes. It's not only a way to communicate with God, with the higher being if you don't believe with
It's a
God.
privilege.
Yeah. So si Margie's na ano daw yung kanyang connection. I'm so sorry, Margie. Mag-upgrade ka na. Yes. Aldred Velasco. EPM daw natin siya. May lotion. Yes. Dina Amores.
Dina
Vice Ganda. Woo! Vice Ganda. Yes. Good job.
Yes, I've seen that movie.
Yes. Yeah, Sir Jack saw that movie.
All right, at the theater.
Yeah, but then I have to translate. So
The whole
Kinjai,
thing.
no, it's not Tony Gonzaga. No. So, Epiroa, hello, Dr. Farrah and Sir Jack. So, again, let's go back to cancer because Sir Jack keeps, you know.
Sorry about that.
So you decide natural medicine, you have to look, you have to do your research. Yan naman ang pinakamaganda. And if you come up with the research, you decide, you give it up to the Lord, okay? That's the best thing. Always give it up to Him. Lord, bahala ka na. Yes. Kasi yung iba, there are just many things that we can control, but majority of the things in this system, we cannot control them. That's why most of us are victims, which we are victims sometimes. Most of us are not victims, but in many circumstances, we are victims because of other people's choices. But it's not that bad.
So,
don't think about it as being bad. Just give it all to the Lord.
when someone chooses natural, in fact, someone probably make a nice video of this. When you choose natural medicine as your preferred treatment option, what is your first step?
So if you choose natural, you change your lifestyle. Diba? Unang-una, the food that you are taking in. Like what I said, cancer, they love sugar. So wag ka nang kakain ng matamis. Kahit organic pa na matamis yan. Do not eat anything that's sweet. Cancer has 96 receptors for sugar. While the normal cell has 4 receptors for sugar. So, konti lang talaga yung sugar na pumapasok dun sa normal cells. And you have a cancer cells that just gulping all of the sugar in your system. So, that's the first thing to do. Do not eat foods that are sweet.
Or rice, bread, and pasta.
These are simple carbohydrates like what Sir Jack is saying, which are converted to sugar. Wag
Quickly
na.
and easily.
This is just my opinion, because other doctors, if you go, they have different opinions as well. But for me,
Well, it's also the opinion of Dr. Walter Willett, the lead of nutrition at Harvard University, because he was sharing recently the results of the Shanghai Women's Study that showed a distinctive relation between rice consumption and type 2 diabetes.
and what is the result?
It's causal.
Causal. So, if you eat a lot of rice, then you increase your incidence of developing diabetes and also some type of diseases. Of course, pag may diabetes ka na, sakit diyan sa puso, pwede ka mabulag, pwede ka magkaroon ng kidney failure. It's all there, you know. I think diabetes is one of the worst condition that the modern society has ever faced. So we just have to change our diet. No more processed food.
It's the
Lalo
same.
na tayo, mahilig tayo sa hotdog.
Same here in the
diba?
States, though. I mean, back in 1960, your incidence of diabetes was typically around 1%. The majority of those were type 1 diabetes. And now it is, last I saw, around 12%, and the vast majority are type 2 diabetes. You know?
So, yan ang problema natin. Okay? So, no more processed food. Baka kasi tayong mga Pinoy, di ba, mahilig tayo sa noodles, di ba? Yan, bacon, hotdog, mahilig tayo sa ganyan. Huwag na, kasi yung mga yan, they are related to types of cancer, particularly stomach cancer, colon cancer. Huwag na. So, iwasan na natin yung mga ganyan. As much as possible, you eat foods that are organic, whole foods. Yan. So, pwede ka naman kumain as many as you can. You can eat as many as you can, provided they are organic. Okay?
Well, the question earlier, when I was talking about a low-carb / keto diet, a lot of people, they're very, very confused by that, because your diet that you use for anti-cancer, Mom, is often, by a lot of people, been referred to as a keto diet, which basically, when you're talking low carbs, what you're talking is low or no simple carbs. Now, complex carbohydrates,
It's okay.
it's perfectly fine, like your green leafy vegetables and things like that. Things that are typically very low in calorie but very nutrient dense.
Yes,
Correct?
yes. Also spices. If you are into processed food and you wanna divert, you can go to spices. Spices are good for you. Cumin, turmeric, garlic, ginger, all of this, lalo na yung garlic, there's a lot of research that shows that garlic decreases the incidence of types of cancer, particularly your colon cancer, stomach cancer, breast cancer, even prostate cancer. So, kain ka na nakain ng garlic, di ba? Onions! Kailangan nangangamoy ka. You should be smelling like garlic when you talk. So, I mean, if you're not smelling like garlic, then you're not eating garlic that much. So, kumain ka ng maraming garlic. These are all good for us, for cancer patients. So, kumain ka ng maraming ganyan. Yan. Green leafy vegetables, they're rich in magnesium. Magnesium, as I have told you, yan, I have a magnesium here. Yan. This is my favorite, actually. Yan. Magnesium, the lower the magnesium, it is associated with types of cancers like lymphoma, leukemia. Imagine, just by not eating green leafy vegetables, you will develop types of cancer. Not only cancer, hypertension, diabetes, anxiety, stress,
And someone asked
migraine.
moments ago about the carnivore diet, which I believe the carnivore diet, from my understanding, is it's all meat. Which, obviously, if you're eating just all meat, how the heck are you going to get vitamin C?
Well, when I was in college, they told us that consumption of meat is associated with cancer. Yeah, so pag kumakain ka ng maraming meat, yeah. But that was a couple of years ago while I was in med school. Right now, as far as I know, like what I said, I allow people to eat meat. But as much as possible, concentrate on green leafy vegetables, concentrate on good proteins like eggs, diba? Eggs, white meat, yan, maganda sa atin yan, fishes, yan. So, I wish the world is a more perfect place.
Yeah.
Yeah, because right now kasi we are being bombarded. We polluted our soil, we polluted our air, our water. So we are in the process. We also put all of this. We did all of this. So we are responsible. So I wish the world is a perfect world. Hopefully in Jehovah's time. Yes. So what else?
Q&A.
Q&A. Okay. So we're gonna do this.
Give us some good questions here.
Yes. So, Emma Unat is asking about the shampoo that you can use. There are different types of shampoo that you can use. You can use lemon, diba? The internet, the internet is such a good invention. I remember when there's no internet,
You actually have to go to the library.
I think I'm gonna go crazy. My
Just for-
mom, listen, when there's no internet, I was always outside. And I told my husband, I would be gone 12 o'clock up until 3 o'clock in the afternoon. And I would hear my mom, Farrah! She would scream. And I know it's time to go home. And then there's a big wood that's waiting for me because I'm always gone. So I have a smacking. And then after that, of course, I will be gone around 5 o'clock again. 5 o'clock up until 7. That's the time that I go home when I eat. So that's what I did when there was no internet. So I don't know what Sir Jack did when there was no internet.
I played.
Yeah.
I played, you know. I would, like Jody Kirshner, I'd be out in the woods, you know, exploring with her brother. We'd be playing baseball, be riding bikes, going swimming. You know, just 1,000 different things. Now, unfortunately, I see the kids are just, you know, tucked in front of gadgets all the time.
He has the Nintendo. He has the Nintendo and the Game Boy.
No, I didn't have a Game Boy. I had,
You had the
an
Nintendo.
Atari back in the day. Actually, I didn't have a Nintendo. My neighbor did, and we would go play Mike Tyson's Punch-Out.
So he's more social than I do. Because when it was me, I would just play outside with my baby
play outside all the
brother.
time.
Yes. So with
If there was a tree, I was going to climb it.
with my baby brother. Okay. So you look at the internet for the shampoo. Look at the internet. There's so many there. You can use lemon. You can use virgin coconut oil. You can use white vinegar. My second book, there's some of the there's some article there that you can see that I gave some home remedy, kitchen remedy for using for shampoo, for also for dandruff and for skin diseases. So it's gonna come out. That's gonna come out soon. Also, my another multivitamins. It will come out also either this December or next year. It's the first of its kind in the market. So please, look at that.
What advice can you give for a patient with a cardiomyopathy, more on the left side, developmental ascites due to heart problem?
So cardiomegaly, it means malaki yung puso mo. Usually on the left side. So that immediately tells me that you are hypertensive. Because usually those people who have left ventricular hypertrophy, cardiomegaly, they usually have hypertension. So, pixie dust. Saan ka pa? Pixie dust na. Yan. So, pixie dust, magnesium, just drink 1 teaspoon 3 times a day. Drink it. And also, you can use lemon. Yan. Not lemon. Lemongrass, garlic, ginger. Yeah. So, just blend them. Or if you are brave, like Sir Jack, he's brave, you can eat them. Yeah.
Itching pole is the best invention.
Yeah.
Let's talk about AML, Mommy.
Honey?
AML.
AML. Nako. Sinong may AML? AML, it's a type of leukemia. Acute myelocytic leukemia. It's a deadly type of leukemia. Usually, you see it in adults rather than in children. For children, usually they call them ALL. So, if you have leukemia, of course you would have symptoms of bleeding, papayat ka, anorexia, weight loss, di ka makatulog. Again, like what I said, some types of leukemia are attributed to a deficiency in magnesium. So, always have magnesium with you. That's the best thing you can do. And a plant which is chichirica. So, they call it periwinkle, vinca alkaloids, which they a couple of years ago, when they were developing some chemotherapeutic drugs, so they got that chemo drugs from that plant, so vinca alkaloids. So just boil it and then drink it as many as you can. You can juice it as well. So depende na po yun sa inyo. The entire plant, you can use the entire plant. Also the roots. Huwag mo lang patayin. Kasi sayang naman, di ba? Lalo na mag-grow pa yan. So, just, the plants, the stems, and everything. Yes! So, Maria Leslie is talking about PCOS. Polycystic Ovarian Syndrome.
You just got another
Mare! Okay. Josper, I think Josper had PCOS, di ba, Mare? Nagkaroon ka ba ng PCOS? Sumagot ka. Nanonood siya. Because Josper is watching. I think Josper had PCOS also. Again, with PCOS, like polycystic Okay. Lagi mo tinitingnan yung polycystic so pag nakakita ka ng like liver cyst, diba? Thyroid cyst. Pag nakakita ka ng cyst, ay, si Mary Hazel Ruth. Wag ka masyado, Hazel. Secret. Hazel. Yan. Wag mo.
No comment.
No comment. Oh, talaga. Yeah, si Josper had PCOS. So if you
What am I drinking? I'm drinking black coffee.
If you see
Black
cystic,
brewed coffee.
always, if you see, you have a lab test, diba? Nakita ka, cystic, always cystic. Ibig sabihin yan, you had deficiency in iodine. Deficiency in iodine. Unang-una yun. So, you get something, you eat seafood, seafoods yan. Kumain ka ng ganyan. Okay, sis. And you are drinking too much coffee. Yeah, because too much coffee is associated, it decreases your iodine. So please do not do that. Pwede ka rin uminom ng guyabano leaves, tea. Pwede ka rin uminom ng damong Maria pag may PCOS ka. Yeah. I have one, si Rommel something. Rommel, sana nandyan ka. Romeline, yes. O si Josper, na-diagnose pa daw siya ng adenomyosis and endometriosis. Yeah. But she had a baby. Di ba, Josper, they told you you're not gonna have any more baby?
They were wrong.
They were wrong. And these are doctors that here in the US, they're good doctors also. Di ba? Di ba, Mare? They told you hindi ka na daw magkakaroon ng baby. And she had a baby. Oh, kaya do not also listen. Mary Hazel is saying, yeah, shh. Yes. So, do not also believe. Huwag ka masyado naniniwala kasi we are all imperfect. Like what I said. Mga ano tayo hindi naman tayo perfecto. Ang makapagsabi lang talaga niyan si Jehovah. Okay. So, next question.
Hold on a second. Ovarian cancer. What sort of treatment would you use for that, Mommy?
Now, there's a research about ovarian cancer. You should listen to this. Sabi nila, ovarian cancer is associated. Josper said she did natural, yeah. So, sabi nila, balik tayo sa ovarian cancer. Sabi nila, if you have ovarian cancer, you have a deficiency in silica. So, what is the plant that is high in silica? So, it's horsetail tea. So, try that, horsetail tea. And let me know.
And obviously, dietary protocol and proper nutrition.
Let me know if it helped you. That's the recent discovery. That was a recent discovery right now. They are associated with silica, which is high in horsetail tea, diba? The horsetail tea, you can see them. Sa Pinas, ang dami niya, diba? The one that is like a tail of a horse.
Yeah.
It's like that. It's so long. Or you can just Google it. Just Google it. And you can see a picture. And if you have Boston C, of course, try Boston C as well. Boston C, mega dose vitamin C, and Pixie Dust. But if you want to do it the natural way, I think the tip that I can help you, and I hope it helps you a lot, the horsetail tea. Okay? You can also use the Mung Maria. The Mung Maria.
What about esophageal cancer?
Oh. So, esophageal cancer, okay. If it's the problem that if it's too big, it can block your esophagus. So you might have problems eating, and that's the most common reason why this cancer, these people have cancer in the esophagus. The ones on the alimentary tract, they usually die kasi they do not eat. They cannot eat. It's not because they do not eat, but they cannot eat. They cannot take in anything because of the esophageal mass. So I think the best thing for you to do is a mega dose vitamin C. Now the problem with this is it's too strong. Maski ako, even me, I cannot drink a mega dose vitamin C that much. It's too strong. So what I can tell you is that just put water on it. Put water or drink it with food. Yes.
Worst case scenario, get a pig.
Alam mo, nahihirapan din. Minsan, when I started with natural medicine, it was also difficult for me because I have always eaten foods that are not so good for me.
Foods.
But then, lalo na kapag kami mga tukneneng na ganyan, tukneneng, diba, potato, kung anong french fries,
Potato
diba?
corn.
Yung mga kinakain ko. And then when I started with natural, it was also a struggle. I can barely drink them. Minsan sinusuka ko pa. But then, it came to a point that I got used to it. So, ano lang, just try to, because your body will get accustomed to it, especially the vitamin C, because we do not make vitamin C.
No.
As humans, we don't make vitamin C.
We're one of the few mammals that do not.
Yeah, so we are at disadvantage. Lalo na kapag in stressful moment, di ba, yung vitamin C mo, you don't have vitamin C reserves already, tapos di ka pa uminom ng vitamin C. So what will happen? You will have scurvy. Mm-hmm. Actually, back then, there was a literature that says that because they did not know cancer back then, so they were thinking that cancer and scurvy, they have the same symptoms. So there was one scientist who associated cancer with the deficiency of vitamin C because they have typically the same symptoms as a wound that doesn't heal, diba? Tapos makikita mo there's petechia all over the body. So they associated vitamin C deficiency with the cancer and scurvy. So I hope that helps you a lot. Okay po.
Reactive lymphadenitis.
If you have reactive lymphadenitis, ibig sabihin lang niya, may kulani ka na. It can be because of PTB. Yan. It can be because of a virus. Yan, lalo na yung mga CMV, Epstein-Barr virus. Yan. So mga yan, nagkakaroon ka ng mga reactive, nagkakaroon ka ng kulani. Yan, masakit yan minsan. Sometimes naman, hindi naman masakit, di ba? Iba-iba. Sometimes, wala lang, ganyan. So, the best there is, if it's a virus or a PTB, vitamin C can help as well. Alagaw, yan, nakakatulong yan sa atin. So, last question. Yes, for everyone. What causes frequent nosebleeds? Sabi ni Patty Martin. Well, Patty Martin, there's several types of nosebleeds.
When I was a kid, I used to.
I have a story.
I would pick my nose a lot and get nosebleeds, so that was the cause of mine.
Okay, I have a story for you. My eldest Kyla, when she was young, she would wake up and her bed is just bloody. It was all blood. And then
from her nose.
Yeah, for several years it was like that. And then my mom was always telling me, pa-check up mo na, patingin mo na sa doktor, ganyan. Sabi ng mama ko sa pedya, patingin ko daw sa pedya. But I said, but my dad had the same condition. And my dad, there was no problem when my dad was younger. So I listened to my dad. So my dad told me, probably that happens because some children, they are more prone to have nose bleeding. And guess what? It stopped. When she reached the age of, I think 9 years old, 9 years old, it stopped. And she was healthy, she was okay, she was perfectly okay. So some bleeding, especially if you're young, they just happen because of the fragility. They're just fragile. The nasal mucosa sometimes. They're very sensitive also when it's too hot, when it's too cold. So this can also cause nose bleeding. Yan. Also, if you have blood dyscrasia, punta tayo dun sa more severe types. If you have blood dyscrasia, you have some type of problems in the blood, clotting factors, you can have bleeding also in the nose. But not only in the nose, you can have bleeding if you're a girl. You can have bleeding per vagina. Yan, nagkakaroon ka ng ganyan. So, pwede rin yun if you have some types of, yeah. Sabi ni, what is that? She said that she also had, Aida Angeles Espiritu said, good evening, Dr. Farrah. When I was young, she said that she was like that she had nose bleeding as well. But you're okay, right, ate? Ate Aida? You were okay, right? Hindi ka naman namatay, di ba? Because if you're dead, you will not be talking to me right now. Yes. Okay. So, last question.
One more.
Okay,
I want to
question.
address a person here real quick.
Okay.
Because it was Gemma Ventura. And Gemma Ventura was asking, does Boston C shrink tumors? And I'll address this myself.
Okay.
Because Boston C has been the cornerstone of Dr. Farrah's treatment protocol since 2002. Back then, Boston C was tested at the University of the Philippines lab there at Diliman and found to be extremely effective against half a dozen different cancer cell lines. It was later tested at St. Luke's Medical Center by Dr. Gil Vicente in vitro and in vivo studies and found to be very effective against cancer cell lines. And I believe it was 2004 or 2005, I'd have to look it up again, was actually presented in Seoul, South Korea to the World Health Organization conference there as far as being very effective against multiple cancer cell lines. So, obviously we're now in the US and I can simply really only refer to in Philippines, Dr. Farrah's significant track record of success, having Boston C as the cornerstone of her treatment protocol. The test done at UP Diliman, which showed significant reactive effects against multiple cancer cell lines. The St. Luke's tests that were done. So, to answer your question, historically, has it been demonstrated to be very effective against numerous cancer cell lines? The answer is yes.
Okay. So, thank you for that, Sir Jack. Hello, Candy Cocktail Sparkling. Yes, you have a beautiful name, Candy Cocktail Sparkling. Yes, Esina Perion Galaraga. Nawawala daw ang kanyang internet. I'm so sorry. Yes. So, Churu Kawa Bell. Me too. It was gone when I grow old. Yes, the nose bleeding. So, you do not need to panic because the nose bleeding usually goes away. Oh, huwag kayong magpapanik. Kung nagpanik ako, ang dami kong pinainom na gamot sa anak ko. So, what I did is I just heed another advice. Yes. More questions daw, sabi ni Sir
Take a
Jack.
few more questions.
Antoinette Espacio Benitez. Yes. Nilda Villanueva. Hello, Miss Nilda. Kamusta po kayo? Claire Visperas. Ano pong ulit na gamot na pwede i-take pag may diabetes? If you have diabetes, the most important mineral that you can take is chromium. Yeah, because chromium, it's actually a mineral that is being removed when you eat foods that are processed. So, there was a study that associates chromium deficiency to the occurrence of diabetes. So, best thing for you is to drink a chromium supplement. You can drink it 200 milligrams 3 times a day. Kainin nyo po yun. And then you also change your diet. Because again, diabetes is a lifestyle disease. So if you will not change your lifestyle, you will not get better. Lalo na ang diabetes some people they just say, kasi ang dami-dami ng diabetes, di ba? So sinasabi na lang nila, ay, wala na yan, di ba? But it's a very serious condition. You can go blind. You can have a heart attack. Your kidneys can shut down. You can even lose your hands, your fingers, your toes, if it's an unmanaged diabetes. So it's and if you have diabetes, you can also develop some type of illnesses, cancer, di ba? So, you have to handle, we have to fix diabetes. We have to educate people about diabetes, how important it is. Lalo na kapag lalaki ka, impotence, di na tumatayo, di ba? Paano ka magkakaroon ng baby? Hello daw! Shout out!
Shout out for my mom, Lita Andres, breast cancer fanatic of yours.
Woohoo! Yeah, breast cancer, lalo na ang breast cancer, di ba? So, but you can live with cancer again. So, Kumisol Cruz is asking about a steroid substitute. Well, the first steroid actually was, the ones that is natural, came from a plant known as wild yam. Wild yam. So, look at it. So, wild yam, it's a plant. So, that can be a substitute. But I'm not saying that you can use it as a substitute for your ailment. Yan. Again, this is for entertainment purposes only. Yes. Ana Teresa Tokiwa is asking about boils that doesn't go away. So the boils that doesn't go away, you can have a topical like with alugbati, gumamela leaves, yan. So put it, make it in a poultice.
Yeah,
tapos lagay mo lang dun sa boils. And then you can also drink siling labuyo, yan. Regularly, drink siling labuyo regularly, garlic and ginger. So they're automatically your substitute for your antibiotics.
Someone's just asking, do we have testimonials regarding our powder products? Absolutely, significant number of them. The thing is, what we don't have here in the U.S. at the moment is accessibility to everyone, like as far as the camera crew and things like that are concerned, because when we were in the Philippines, realized everybody would come to the clinic and they would have their results and you know their lung cancer is gone, their liver cancer is gone, all these things. And so we actually had a in-house video crew there at that time. If people want to do testimonials, which typically only about 1 or 2% of people actually wanted to do a testimonial, and so they would film it with us. But now, you know, here in the U.S., the geographic limitations that we have, because my wife's not seeing patients anymore, are just too great. I mean, for example, if I wanted to send a video crew to film someone in Seattle, Washington, or in New York City, or in Broken Branch, Arkansas, it's just not feasible for us to do that. And most folks, again, you have to realize when they get sick, they don't want their family to know, they don't want their friends to know that they were even sick. So, but when it came to converting the products from the Philippines, which were wet products, over here to the U.S., which are dry products, first of all, my estimation, and Doctor's as well, the product is far better now than it ever was before, simply because we have access now to world-class ingredients for them. Whereas in Philippines, you have to realize the importation of things there is often very problematic. We all know the problems that are in customs in the Philippines. And so when it came to getting, you know, the absolute best raw materials, it was very, very problematic in Phil.
Yes.
Whereas here,
Okay.
it is better than it has ever been. It's 5 times the product.
Okay, last question. Dre SP is asking me about minerals, Boston C, magnesium, and vitamin C for infants and for toddlers. Okay, so this is what you know. When you are a baby, nandito tayo sa ating sinapupunan ng ating mga magulang, ng ating nanay. Okay, we get our minerals from them. That's why some mothers, diba, the baby, they need calcium. So, saan sila kumukuha ng calcium? Dun mismo sa nanay nila. Now, some of the minerals, they have mineral reserve. In some literature, it says that the mineral reserve is actually up until 6 years old. So, meron silang mineral reserve, which they got from their mom for 6 years. After that, the minerals, you do not get it anywhere. The only way that you can get your minerals is through food. So, pag hindi ka kumakain ng foods na walang mineral, if you eat foods without minerals, then guess what's gonna happen? You don't have any minerals. And then you can have certain types of diseases. Now, if you are like me, OC, with reading, there are several conditions that are associated with a type of deficiency in minerals. Like I told you, with diabetes, it's chromium. Like if it's hypertension, anxiety, it's magnesium. If you are infertile, you most probably don't have zinc. If you are bald, you're obese, you don't have any zinc in your body. If you have diseases in your immunity, you don't have any zinc. Okay. Now with the vitamin C, like what I said, we do not have the vitamin C. We lost the capacity to make vitamin C a long time ago. That's why it's very important to have vitamin C. Yeah. If you look at it, there's many literatures right now. There's many research right now that you can really look. Dre SP, you can look there. You can do many of your research. Ang dami. And they are associated, ang daming condition na associated with a deficiency in minerals. Yeah. So, look at it. Yeah. Just do your research. If you can always private message me. The problem is if I can see them, because I have so many messages in a day.
She tries to get to as many as possible. You know, I've actually had someone last week, they were very upset because Dr. had not responded for 2 days. And I explained to her that I had, after going through about 5,000 messages, I came across that one. And they were upset. And I said, I'm really sorry. First of all, Dr. is a wife. She's a mom. She's a writer. You've just finished your second book. You're a student at Harvard. You have a lot to do.
But they can always private message Kenjaya, Goten Collado,
Just be
Mikael Esguera, Chris Eris, what's the KG Will. So these people, they will answer. If they don't answer, you tell me. Pagagalitan natin sila.
Nes Belcarci Estrada, I was referring to a frozen shoulder. Obviously, significant number of people have success with chiropractic for frozen shoulders.
Okay.
So please consider that.
Okay, that's it. Thank you very much for watching, and I hope to see you soon. I have some good news.